Hello everyone, I'm Chris Kotlowski with the Rise Up 21 program. And I am super excited this afternoon because I have Jenney Britain with me. She's a physical therapist and she is here to share some really interesting concepts and ideas. And I really think she's going to share some things that you may have never ever heard about or thought about, especially when it comes to our bodies. So Jenney's a physical therapist, but you also specialize in myofascial release. What is that?
So the fascia system is a connective tissue system that runs throughout the body, head to toe, and it's pretty continuous. Fascia wraps around the muscles, it wraps around nerves, it wraps around joints, all throughout the body. So anytime you're moving your arm up ahead, your fascia is moving too. It's stretching with your muscle.
So it's all connected, and when I was reading up on what this is, it's like cobwebs throughout our body, right? And it's like they move and they stretch
and they slide and they glide.
So when we talk about that release, what if I was to be a patient or someone to come in, what do you do as a therapist?
So as a physical therapist, I would evaluate you and ask you where your pain was.
Okay.
If you had maybe a sitting job, you point to your neck because there's tension in your upper trapezius muscles. So I think about all the different areas that are, in your neck. Do you have good flexibility in your chest? Do you have good strength in your upper back? Do you have good motion of your neck? So all those things are physical therapy. Myofascial release is one of the tools in the toolbox that we can use to treat that and get things moving again. When the fascia gets real tight, it starts to push down on the muscles, and we talk about degenerative changes in the muscles as we get older, or not in the muscles, in the bones as we get older, right? Talk about arthritis. The fascia has a lot to do with that because it's compressing on those bones. So as we release the fascia, as we get that slide and that glide back again, the muscles and the bones are able to move easier.
It almost seems too simple to be true. So what type of a person benefits the most from this type of a treatment?
So I'll just speak from personal experience. So I've been a physical therapist for 19 years and I work a lot with my hands. So I do a lot of myofascial release with my hands. We'll get into the tools later on that make my job a little easier, but I was having a lot of tension in my forearms.
Okay.
So I went to massage therapy. She worked on things a bit, but once I started working on the fascia, that loosened things up to make my stretches more effective, to make me have less pain. Also, as a runner, you use your muscles in a very repetitive fashion when you're running, and the muscles get tight, even though we stretch them out. My knees were starting to hurt, and so I started doing some fascial work around the knee joints and in the hips, and things are better. I'm better able to run. I'm not any faster, but
I bet you are.
But I don't have as much pain.
I will guarantee you would outrun me. Well, with the Rise Up 21 program, we talk about building your strength, working on your cardiovascular system, your balance, and your flexibility. So when someone comes in, you look at all of those ranges of motion, but also how do they walk, and what else do you look for?
A lot of times we get into our certain patterns, and so the muscles that we use are stronger and the muscles that we don't use start to get weak and stretched out. So we take a look at how are things balanced. The shoulder joint is a perfect example. We do a lot of forward, think about all the typing that we do, think of the driving, think of the making the bed, folding the laundry. Everything is strong but tight here. And if we don't focus on strengthening our backs and sitting upright, and working on the muscles in the back, then we get an imbalance in our shoulder, which could lead to impingement, rotator cuff issues. And so as a physical therapist, we look at sitting upright, stretching out, strengthening, and getting the whole picture.
So myofascial release is really head to toe treatment, right? So anyone with neck issues, hip issues, back issues, knee issues, feet
ankle
issues, anything.
Headache, jaw pain, all of it's combined.
As you have the therapies, talk about circulation.
So that fascia surrounds blood vessels. That fascia surrounds nerve tissue. So if we can release that, sometimes circulation does get better. Where people had cold feet before, now it's a little bit warmer with the myofascial work in the legs and the calves. Think about people who have standing jobs all day.
Right.
There's compression garments to keep the blood from pooling. Pooling's a strong word, but staying down in the lower legs, that fascia system can work to pump it back up.
Well, and if you're active on the Rise Up program, you saw with my feet up against the wall, getting that blood flow and circulation.
Yes.
So you have a bunch of fun, I don't know, interesting gadgets over here, and I think we should show them to everyone
I think so
and see how they're used.
So I have some Graston tools. So Mr. Graston was one of the first ones to develop tools to work with the fascia. What it does for my profession is that it saves my hands because we can work on a general area without as much muscle on my part.
Okay.
Another tool that I have is called a fascia blaster. So this is another way just to manipulate the fascia and make it mobile again. The Graston tools are more of a professional grade. The fascia blaster is more for, you can buy it on the internet and use it yourself. And it's a really great complementary tool for my patients who the Graston works for. Because
so when someone comes in, does it hurt? What do they expect during the hour that they spend with you?
So during the hour, first of all, I do a lot of touching people. So so I will check to see what your skin mobility is like. How your skin glides and slides on the muscles underneath. So myofascial, the myo part is the muscle part, and the fascia is the fascia system. And we really want those muscles gliding on each other. So the upper trapezius, the scalenes down in here, the sternocleidomastoid, there's a lot of different muscles that have to maneuver in order for you to move your neck. And so the first thing I do is I start poking at you and seeing if you have tender areas. You tell me if you're hurting anywhere.
Okay.
And then we get to working on it.
Great.
Should we work on it?
Yes.
Let's do it.
I'm so excited.
All right.
What do you want me to do?
So you're going to turn your chair sideways. So
Okay.
you can get a little bit. That's right there.
Hey.
All right. So with the Graston tools, we use a little bit of emollient because that helps the tool slide and glide. And even with the fascia blaster, you do want a little bit of oil on your skin. There we go. So these different tools have varying treatment edges. I'm just going to push this up.
Okay, yeah, do what you have to. No problem.
Right, and it's just short little strokes all along the muscle. Sometimes where if somebody has an issue, if there's a muscle knot, that can redden up rather quickly.
Okay.
Do you have any issues on this shoulder, Chris?
No, feels great.
Good. It does feel like a really nice little massage. So if you're tender though,
It's a little tender up through here.
yeah, right in there.
Yep. And I always carry my tension there.
So when you're tender, I lighten up a little bit. This is always going to be kind of patient-directed care. And we work as a team to help try to figure out what your pain is coming from.
Do you ever do forearm?
All the
you
time.
said that. Yeah,
I
forearm.
do. Yeah, forearms, hands.
So if someone is watching this in our program that says, oh, I really am struggling with whatever, the best thing is to call you or email you and say, this is what I'm struggling with. Is it something that would, well, one, physical therapy is great for what? Pretty much everything?
Pretty much everything. I mean, physical therapists, there's all types of physical therapy. I specialize in outpatient orthopedics, so that's basically head to toe, except for hands. I don't know much about hands. That's what the occupational therapists are for.
Okay.
But anything else, knee pain, back pain, ankle pain, balance, walking problems, neck pain, shoulder pain, anywhere.
That's awesome.
So you're getting a little bit red up here.
Okay.
When I do my treatment, I tend to change instruments.
Okay, change away.
Change away. We get a little bit more specific up into the neck.
Okay.
Right? So go ahead and keep your head nice and straight.
Okay.
Only because it might be a little less comfortable if those muscles are on stretch.
So when someone comes in for a treatment, they lay on your table?
Sometimes.
Okay.
A lot of times if I'm doing the upper back, they'll sit in a chair like you
Like
are
I am?
first.
Okay.
Yep. And we'll get at that area and then I'll have them lay down and work a little bit more specifically into the vertebrae.
I can just tell it's so therapeutic, and I'm just learning about your services, and I feel like, darn, I wish I was younger to.
The thing is, it's never too late, you know?
Okay.
Like, you think and I'm not saying this is what you're thinking, but
No,
some
it's fine.
people just expect to feel hurt and they expect to feel degenerative as they get older, and it's just really not the case.
Not the case.
It's not. You know, fascia can get tight with repetitive motions. It can also get, tight with scarring if you've had any sort of, abdominal surgeries or low back surgery. A lot of the times, that scarring will adhere and the skin doesn't move as well.
Absolutely.
Accidents, different things. So, I mean, anybody can really benefit from it.
So you said surgeries. So if someone has scar tissue, you can use this to work the scar
You
tissue?
can, absolutely.
Okay.
Yep. How you doing?
I'm great. I love this.
Good.
I can tell it's really, I'm gonna be lopsided. After we stop the tape, you're gonna have to do this side.
Absolutely, absolutely. But these tools really allow me to kind of, dig in and kind of separate the muscles out.
Yes.
What I'm imagining in my head is just what all these muscles look like underneath your
Okay,
skin.
that makes sense.
The upper trapezius fiber is running one way, the scalene's running another, and just making sure that they're all mobile.
Okay. So if someone was to come in, say, we'll use my neck. Sorry.
And then we lighten up.
This is not edited.
This is real. And then we lighten up a little bit.
I love it. If someone was to come in with really tight neck, just shoulders like you're working on, does it depend on the person as to the number of treatments that they need, or is it like, okay, once a week for a while, then goes every other week, and then once a month?
That's a really great question. It really depends on what the functional difficulties are, right? If you have trouble turning your head and looking to check your blind spot,
Right.
for example,
Right.
we're going to get you in a little more often because checking your blind spot's a pretty important thing.
Safety first.
Safety first.
I do have to say, like, sometimes if I look over my left shoulder and sometimes when I look over my right shoulder, my range of motion is much different.
So yeah, that's just something,
Awesome.
people notice, but they don't do anything about. And it's better to take care of those little things before they become big things.
So I do want to mention self-care. This is part of us taking care of our bodies and just taking the time to say, I deserve to feel better. I don't have to feel this pain or this tightness, and just honoring the fact, like, this is the only life we get to live. Let's live it as healthy as we can.
And sometimes it's a really easy fix.
Okay.
If the pain you have, just come get it checked out, I see a lot of different patients, and I know a lot of levels of
In all
of
ages.
dysfunction, all ages, absolutely. Yep,
Okay.
young to old.
Okay. Have we covered everything? Do you have anything else to add?
I don't think so.
Do you want to use that blaster thing on me? I'm curious.
Do you want me to use the blaster thing
I'm
on you?
curious.
So the fascia blaster, this is a face blaster, so it specifically gets up into these little muscles in the neck. Now we do want to be careful, right, because we've got some arteries in there.
Okay.
So you want to go digging at all, but it's really great to get these little claws. Like
Oh, that feels
you could
good.
take this home and soak up in the shower and then
Right.
use that thing for 20 or 30 seconds right in that space.
And when do
every
we
day.
ever do this?
Right. never.
Oh, we never take the time at home.
Nope. And really, it doesn't have to take a lot of time.
Right.
But self-care is worth it,
It's-
If you're gonna be good for your day, you gotta take care of yourself.
100%. So we're gonna close with a few things. You can keep doing that. I'll just talk.
I want to make sure I'm not missing any spots.
I do want to mention that. So Jenney is, of course, a physical therapist. Have you been practicing for a long time? How long have you been doing
Yes,
it?
in Madison for 18 years and here in Stoughton for 4.
So she actually started when she was like 12.
Sure.
Right?
Yes.
Or younger. So I am going to post this on our Facebook page, and thank you first of all for coming in. This is
Absolutely.
awesome, and learning something new to take care of ourselves. And then if you have any other questions for Jenney, she'll be on the page. Post the questions, and then I will also share her email information with you, and just any other thoughts that I have after we stop taping, and when we chit chat, I'll just post any other ideas and thoughts for you. So enjoy your myofascial release, everyone, with Jenney.
Thank you.
Thank you. Take care, everyone. Bye.